Good afternoon, everyone, and thank you for joining our daily COVID-19 briefing from the City of Philadelphia. Today, we are exercising new social distancing measures for these daily briefings. Both the mayor and Dr. Farley will be joining us virtually starting today. We also have Reverend Naomi Washington Leapart joining us virtually to provide some guidance for faith-based communities today. So now we will begin with opening remarks from Mayor Jim Kenney. Mayor, please turn on your camera, and you now have the floor.
I can't turn my camera on because apparently you have control of it. Here we go. We're good. Thank you. Well, good afternoon, everybody. As you can see, I'm not at City Hall today. We have decided that going forward, we're going to make these daily press briefings as virtual as possible. So I'm speaking to you today from my home, and Health Commissioner Dr. Tom Farley, the next speaker, will be in his office when he speaks. We'll also have Reverend Naomi Washington Leapart, Director for Faith-Based and Interfaith Affairs, in our own home. This is being done to practice safe social distancing and to encourage everyone else to follow suit. We are fortunate that technology allows this and that it works most of the time. So with my fingers crossed, I hope my Wi-Fi holds out. Speaking of going virtual, I want to mention that starting this week, the Register of Wills office is offering virtual operations for both probate and marriage license services. These services will be available on an emergency basis only. They would be provided according to criteria established by the Register of Wills office. To learn more, visit phila.gov/wills. That's phila.gov/wills. Now, I want to address a difficult aspect of this pandemic. It was a little over 4 weeks ago that I went to City Council chambers and presented our budget and 5-year plan. Frankly, it seems like an eternity ago. Now, as I sit here, it is clear that with shuttered businesses and jobs lost throughout the city, the region, and the nation, that budget is no longer a realistic spending plan. So I have asked our finance director and budget director to go back to the drawing board and create a new budget and 5-year plan based on the current economic reality caused by this virus. This is unprecedented, but we will do everything we can to prepare and adapt. We will present our new budget to City Council by May 1st. I know many of you have questions, but we don't have answers yet to all your questions. I can tell you that we anticipate that the city will face substantial increase in expenditures and significant decreases in tax revenue because of the larger economic impact of the COVID-19. That means we'll have to make difficult decisions on city spending, the likes of which have never been needed before. Unlike the federal government, we don't have the ability to run a deficit. We cannot spend what we don't have, and we do not print money like they do. This will impact city services and employees. To what degree, we don't know yet, but it will affect things that people care about and expect from their city government. I know full well that any reductions in city services will be painful. You rely on those services. We all rely on those services, and we deserve those services. We will work extremely hard to minimize those impacts and to focus on delivering needed services, especially those on which the most vulnerable Philadelphians rely. You have my word. But we must deal with the reality that this virus has thrust upon us, and that is going to mean all of us making sacrifices in the months ahead. One example of sacrifice already taking place are the efforts of healthcare workers and first responders. Today is World Health Day, and to honor those who are on the front lines, many of Philadelphia's iconic buildings and landmarks will shine blue tonight. This symbolic effort was organized by the Building Owners and Managers Association of Philadelphia, the Parkway Council, and the Center City District. More than 36 commercial, cultural, and residential buildings from Center City to South Philadelphia will change their illumination to blue starting tonight. And the lighting will continue each Tuesday for the rest of April. So please look for that tonight and the rest of the month. And when you see a first responder, give them a wave of thanks from at least 6 feet away. Now I ask Dr. Farley to give us our daily update.
Dr. Farley, you can go ahead.
All right, good afternoon, everybody. We are seeing a continued growth in cases of the coronavirus infection, and we are seeing increasing cases of people hospitalized with the infection. And sadly, we are seeing increases in deaths. For those patients who are hospitalized, our healthcare system is seeing the increase, but they're able to manage this. They're not under strain. Let me give you more details. We now have 544 new cases of the coronavirus infection diagnosed since yesterday in Philadelphia residents, bringing us to a total of 4,272. We are posting more detailed information on the demographics of those cases, on their age group and gender on our website. We're continuing to see clusters of this infection in settings where people live together, called congregate settings. That includes nursing homes, it includes a behavioral health facility, and it includes the city's jail. Since yesterday, there are 4 new inmates who have tested positive, bringing us to a total of 58 inmates who have the infection in the city's jail. And we are working with the city's jail system to try to contain this infection and make sure that those inmates receive medical care. I have to report, sadly, that we've had 20 new deaths from the coronavirus infection since this time yesterday, bringing us to a total of 65. Of those 65, 26 were nursing home residents and 43 were over the age of 70. So not everybody, but this has predominantly been in elderly people and people who otherwise have chronic medical conditions. We will be posting the age and race of those people who died on our website. We tried to do that yesterday, couldn't quite get it done, but it should be posted later today. Now, I'm hopeful that in the not too distant future, we will see a plateauing of the number of new cases of the infection, but the number of people who died from this is going to lag behind that. So this number of deaths will probably continue to rise over the next few days to a couple of weeks. As far as testing for this infection, it still is available in general. We're recommending it for people who are over the age of 50 who have symptoms and for healthcare workers who have symptoms. There are some 20 odd sites across the city where testing is available. If you go to our website, www.phila.gov/COVID, under FAQ, getting tested, there are links and phone numbers to all the different places where you can get testing. Among those, Citizens Bank Park is open this afternoon from 1 to 6 p.m. And will be open for the rest of this week. It will end after the end of the day on Friday. However, there are these other sites that are available. And there is a site in the Center City that's open 7 days per week. And if you're interested in getting tested and you feel you meet the eligibility criteria, just call this number, 267-491-5870. So what's the situation with our hospitals? They are seeing a steadily increasing number of cases, but they still have plenty of room. As of this morning, there were 554 patients with this infection in city hospitals, 956 patients with this infection in the entire Southeast Pennsylvania region. I was asked yesterday about how many of these patients in the intensive care unit. I don't have that number for you yet, but I'm going to try to get that and hopefully be able to report that in the future. There's still plenty of medical beds that are available, about 40%, and plenty of intensive care unit beds that are available throughout the region. Now, we're hoping it stays this way, but in case our hospitals do become burdened, we're looking for additional staff that can help provide these medical care. So we're still seeking volunteer medical workers, particularly doctors, nurse practitioners, and physician's assistants. So if you want to volunteer, just go to www.phila.gov/MRC for Medical Reserve Corps and register, and we can contact you if we need you. And then I want to say again, what we say every day, how important it is for everybody to stay safe and to protect the medical care system so that it's all there when we need it. So if you don't have to go out, don't go out. If you have to go out, for example, you got to go to the grocery store, you got to go to the pharmacy, keep your distance. And when you're around people, now following the new Centers for Disease Control recommendations, wear a mask. Finally, let me just say, I know Reverend Naomi is going to be speaking in just a minute, but just from a medical perspective, Passover starts tomorrow evening. Easter is on Sunday. These are really important times for a lot of people. These traditions are wonderful. They hold us together as a people. Passover in particular is a tradition where people in years past were really worried about the lives of themselves and their family members, but they got through it. And I think it's very relevant now. So I want everybody to be able to continue to celebrate these important holidays, but get together to celebrate, but not in person. Anybody can have the virus. There are a lot of new safe ways to celebrate this. Go to websites and find out how to do it. In particular, synagogues have offering online seders. There's lots of information online. So celebrate it, but not face-to-face with your family or friends. More information on the coronavirus is on www.phila.gov/COVID, COVID. And if you have questions about the medical aspect of this, call 1-800-722-7112. Thanks.
Thank you, Dr. Farley. We are now going to turn over the program to Reverend Naomi.
Thank you. Good afternoon, everyone. You know, the weather is a little milder now, and the birds wake me up every day, and the tree in my backyard is in full bloom. And so in the midst of COVID-19, these little things have been a much needed reminder to me that spring is actually here. And as Dr. Farley referenced, this season is often an important time of transition and reflection and worship for many of us. I'm particularly aware that springtime includes a host of major religious holidays. Passover begins tomorrow evening, April 8th, and ends on the evening of April 16th. And of course, it is the 8-day Jewish festival that commemorates the emancipation of the Israelites from enslavement in ancient Egypt. Holy Week, which begins on April 5th with Palm Sunday and ends on Easter Sunday, April 12th, contains vitally important days in the life of Christian churches as they reflect and remember Jesus's final days. Toward the end of April, probably on the 23rd, but the date might vary according to the cycle of the moon, Muslim communities in our city will begin Ramadan, the holiest month of the Islamic calendar. This period for Muslims represents a time to fast and devote a particular focus to prayer, purification, and charitable acts. My heart aches this year. These holy days must be observed within the context of a deeply challenging circumstance. How can we share Seder meals when we can't sit at the same table? How can we engage in the ritual of foot washing on Maundy Thursday if we can't touch each other? How can we celebrate the breaking of the fast with feasting and prayer if we can't gather for Eid? It is difficult indeed to comply with these emergency health orders, but they do apply to religious and non-religious places alike. I want to offer some encouragement and guidance to our faith communities as you seek to observe these important holidays while maintaining your safety and your health. Since Passover and Holy Week and Easter are this week and next week, we put some special guidance for Jewish and Christian communities on our Faith PHL COVID-19 page after consulting with members of those communities. I want to particularly thank Rabbi Adam Zeff of Germantown Jewish Center for writing the Passover guidance. I reiterate that these are examples and guidance only. Here's a preview of what you will find online. If you're celebrating Passover, consider creating and downloading your own personalized Haggadot on websites like Haggadot.com. In times past, when Jews have worried about the easy availability of food, the ancient rabbis came up with an alternative, setting leavened goods aside and selling them for the duration of the holiday. So consider selling chametz this year. The 2020 Rabbinical Assembly Guide to Passover has very good guidance about the many foods that can be bought without special kashrut certification. Use technology to bring people together for your Seder. If you're observing Holy Week, consider this. Maundy Thursday offers an opportunity to serve the members of your household with humility and gratitude. Good Friday offers a moment to grieve those who have suffered and died among us. Easter Sunday provides the hope we need to know that we will emerge from this difficult time, hopefully transformed. Try something new as you connect the messages of Holy Week to this present moment. Here are some direction and guidance for all faith communities. Please, as Dr. Farley has said, please do not gather in person. Please do not gather small groups of clergy and musicians and singers and other members to conduct worship for a live streamed audience. Please do not rearrange your space to accommodate 6 feet between seats. Any group of any size carries the risk of transmitting the coronavirus. Even if you reduce the size of the group of people who are gathered to 25 or 20 or 15, there is still risk involved. The virus can spread among a small group of people who are sharing microphones or singing in the same room or talking in the same room or touching the same surfaces. Even if people do not have symptoms, they can spread the virus. Remember that no risk is better than minimal risk. These are the same rules that apply to everyone. Zoom, like we're using now, offers an easy-to-use digital space to gather your congregation so you can see each other and hear each other. Some Zoom plans even allow you to simultaneously live stream to Facebook or YouTube. I'm going to post 2 helpful guides on how to use Zoom on the city's Faith PHL COVID-19 webpage. You can locate this webpage by searching for Guidance for Faith and Interfaith Partners During COVID-19 on phila.gov/COVID. Remember that a different service doesn't mean a deficient service. It may not be feasible to export your entire in-person worship piece by piece to an online platform. Consider pre-recording songs or having one person lead music on a phone call or on a Zoom session. And although we can't embrace in person, we can still extend ourselves to each other in loving and tender ways. Consider using mass text message applications like Pastor's Line to communicate important messages or prayer requests with the members of your congregation. The Chaplaincy Innovation Lab has published the Spiritual Care Resources for Religious Holidays Guide, Spiritual Care Resources for Holidays Guide. And the Interfaith Philadelphia organization has offered a digital COVID-19 pandemic interfaith resource guide. These guides might be helpful to you as you plan and connect you to other faith communities who are also navigating this crisis. I'm going to include links to those guides on the Faith PHL COVID-19 page. Friends, remember that this is a time to innovate, time to imagine. We need not worship less, but we must worship safely. I'm sure that this week of holidays will be one we won't soon forget because we celebrated with intention, thoughtfully, and creatively. If you need more support, please email me at faithphl@phila.gov with your questions, your concerns, your ideas. I also want to invite you to join a weekly call that I host at 11 a.m. on Wednesdays for faith leaders and faith organizations. If you want to join tomorrow's call at 11 a.m., please email me at faithphl@phila.gov. Finally, I want to tell you that we are still hosting prayer pauses every Friday, Saturday, and Sunday on the Mayor's Office of Public Engagement Facebook page. This week, we will be led in prayer and reflection by Imam Mohammed Jamandi, Gray Hagins, and Reverend Alan Waller. Join us at 3 p.m. on Friday, Saturday, and Sunday on Facebook Live. Remember that wherever you are, God will meet you there. Let's celebrate safely. May you be healthy, connected, and whole. Thank you.
Thank you, Reverend Naomi. We are now going to go to City Hall, Mayor's Reception Room, where Armando is going to give us the remarks in Spanish today. Thank you.
Buenas tardes. Este es el mensaje del alcalde Jim Kenney para el martes 7 de abril del año 2020. Como pueden darse cuenta, el alcalde Kenney no se encuentra aquí el día de hoy. De aquí en adelante hemos decidido mantener estas sesiones informativas diarias en la forma virtual en lo posible. Esto es para reducir el número de personas en la sede de la municipalidad. Hoy el alcalde les habló desde su casa y el comisionado de salud, el Dr. Thomas Farley, desde su oficina, y la reverenda Naomi Washington Leaphart, directora de Asuntos Religiosos e Interreligiosos, también nos habló desde su casa. Estas medidas se están tomando para practicar el distanciamiento social seguro y para alentar a que todos los demás sigan este ejemplo. Nosotros tenemos suerte porque la tecnología nos permite seguir conectados y en contacto con ustedes. Quiero mencionar que a partir de esta semana, la Oficina de Voluntades Anticipadas, es decir, Register of Wills, estará ofreciendo operaciones virtuales para registrar sucesiones y emitir licencias de matrimonio. Estos servicios, sin embargo, estarán disponibles solo en caso de emergencia. En este momento es importante abordar un aspecto difícil de esta pandemia. Hace poco más de un mes, el alcalde Kenny le presentó su propuesta de presupuesto y su plan quinquenal al Consejo Municipal. Pero la realidad es dura. Con los negocios cerrados y los empleos que se han perdido en toda la ciudad, en la región y en la nación, este presupuesto ya no representa un plan de gastos realista. Por lo que le hemos pedido a nuestro director de finanzas y al director de presupuesto que regresen a foja cero. Ellos están trabajando para redactar un nuevo presupuesto y un nuevo plan de 5 años basado en la realidad económica actual que ha causado este virus. Esto no tiene precedentes, pero haremos todo lo posible para estar preparados y adaptarnos. Vamos a presentarle un nuevo presupuesto al Consejo Municipal para este 1 de mayo. Y sé que muchos de ustedes tienen preguntas, pero lamentablemente aún no tenemos todas las respuestas. Les pido paciencia. La ciudad va a enfrentar un aumento sustancial en sus gastos y una disminución significativa en los ingresos fiscales debido al impacto económico de la COVID-19. Pese a que es aún temprano para cuantificar este impacto, es probable que ronde los cientos de millones de dólares. Eso significa que vamos a tener que tomar decisiones difíciles sobre el gasto de la ciudad, decisiones que nunca antes habían tenido que tomarse. A diferencia del gobierno federal, nosotros no tenemos la capacidad de incurrir en déficits. Nosotros no podemos gastar lo que no tenemos. Esto afectará a los servicios y a los empleados de la ciudad. ¿Hasta qué punto? Aún no lo sabemos. Sé muy bien que cualquier reducción en los servicios de la ciudad será dolorosa. Nuestra gente confía y se merece estos servicios. Y vamos a trabajar mucho para minimizar ese impacto y enfocarnos en brindar servicios necesarios, especialmente aquellos servicios en los que confían y de los que dependen los habitantes más vulnerables de Filadelfia. Pero debemos lidiar con la realidad que este virus nos ha impuesto. Y eso significa que todos tendremos que hacer sacrificios en los próximos meses. Un ejemplo de este sacrificio son los esfuerzos de nuestros trabajadores sanitarios y de los socorristas. Hoy es el Día Mundial de la Salud y para honrar a aquellos que están en las primeras líneas de defensa, muchos de los edificios y lugares emblemáticos de Filadelfia brillarán de color azul esta noche. Esta iniciativa continuará cada martes por la noche durante el resto del mes de abril. Cuando usted vea a un socorrista o a un trabajador de la salud, no olvide agradecérselo, pero siempre a 6 pies de distancia. Y esta es la actualización en materia de salud al 7 de abril del 2020. Hay un crecimiento continuo en los casos y la tendencia es que sigan aumentando rápidamente. El sistema de atención médica está disponible para todas las personas que lo necesiten, independientemente de su estatus migratorio, el idioma que hablen o si tienen seguro médico o no. Hay que recordar que este virus no discrimina por raza o por género. Desde el día de ayer se han confirmado 544 nuevos casos de coronavirus en Filadelfia y actualmente tenemos un total de 4.272 casos confirmados en la ciudad. Hay 58 casos confirmados entre los reclusos. Se está trabajando para contener el virus en los lugares con alta concentración de personas, como las cárceles y los refugios para las personas sin hogar. Tenemos que reportar 20 nuevos fallecimientos en Filadelfia para un total de 65 personas que han muerto ya por la COVID-19. 26 de las 65 muertes se han producido en hogares de ancianos. 43 de las 65 muertes han sido en residentes mayores de 70 años. Respecto al centro de pruebas en el Citizens Bank Park, las pruebas en este centro seguirán administrándose solamente hasta el día viernes 10 de abril hasta las 6 de la tarde. El centro de pruebas de la ciudad en Center City continuará sirviendo a personas mayores de 50 años y a trabajadores sanitarios que presenten síntomas de la COVID-19. Si cumple con esas condiciones, llame al 267-491-5870 para hacer una cita. Recuerde que debe ser referido por su médico primario o médico de cabecera. En Filadelfia hay más de 20 centros de prueba. Por favor, consulte el sitio web phila.gov/COVID-19 con la pestaña FAQ para ubicar el más cercano a su hogar. Los hospitales se están preparando para el aumento de los casos. De los pacientes hospitalizados con COVID, hay un total de 554 en Filadelfia y 956 en la región, y esta cifra va en aumento. Los casos van a seguir aumentando, así es que, por favor, si usted no es un empleado esencial, quédese en casa. Si debe salir a trabajar, le recomendamos mantener la distancia social de 6 pies, lavarse las manos y se recomienda el uso de mascarillas de tela en lugares públicos donde las medidas de distanciamiento social sean difíciles de mantener, como las áreas de transmisión comunitaria significativa, por ejemplo, los supermercados o las farmacias. Mi máscara te protege a ti, la tuya me protege a mí, y es esto muy importante para poder mantener un distanciamiento social eficaz. Sabemos que la fiesta de Passover comienza mañana por la noche y la Pascua de Resurrección el día domingo. Son tradiciones maravillosas que nos mantienen unidos como comunidad, pero no podremos celebrarlas como lo hacíamos tradicionalmente este año, porque cualquier persona podría tener el virus. Como comunidad debemos encontrar formas más seguras de celebrar la fe que profesen. Le invitamos para ello a consultar el sitio web para mayor información, www.fila.gov/COVID. Recuerde usted que puede llamar al 311 si tiene preguntas sobre el COVID-19. Hay servicios de traducción disponibles en 100 idiomas. Si tiene usted preguntas de carácter médico, puede llamar las 24 horas los 7 días por semana al 1-800-722-7112. Y esta llamada es gratuita. Y este es el mensaje de la reverenda Naomi Washington Liebhart, la directora de Asuntos Religiosos e Interreligiosos, sobre las celebraciones religiosas de este fin de semana. Quiero ofrecerles un poco de aliento y orientación a nuestras comunidades religiosas mientras buscan observar estas fiestas y mantienen su seguridad y su salud. Dado que Passover, la Pascua judía, y la Semana Santa, el día de Domingo de Pascua, son estas semanas, ponemos una guía especial para las comunidades judías, católicas y cristianas en nuestra página Faith PHL COVID-19. Quiero compartir algunas recomendaciones para todas las comunidades de fe. Por favor, no se reúnan en persona. No se reúna el clero con músicos, cantantes y con otros miembros laicos para llevar a cabo una adoración o una celebración o servicio en vivo. Ni siquiera reorganice su espacio para acomodar 6 pies de distancia entre los asientos. Cualquier grupo de cualquier tamaño conlleva el riesgo de transmitir el coronavirus. Incluso si reduce usted el grupo de personas que vienen a su lugar de culto a 25, 20 o 15 personas, el riesgo todavía existe. El virus puede propagarse entre un pequeño grupo de personas que comparten micrófonos, cantan en la misma habitación o tocan las mismas superficies, incluso si las personas no muestran síntomas. Zoom ofrece una plataforma digital fácil de usarse para reunir a su congregación de manera que puedan verse y escucharse mutuamente. Algunos planes de Zoom también le permiten transmitir simultáneamente en vivo a YouTube y o a Facebook. Hay 2 guías útiles sobre cómo usar Zoom que están disponibles en el sitio web de la ciudad. Recuerde usted que un servicio diferente no significa un servicio deficiente. Considere pregrabar sus canciones o hacer que una persona dirija la parte musical a través de una llamada telefónica o una sesión de Zoom. También considere reducir el tiempo de su servicio a 1 hora o menos. Y considere utilizar aplicaciones de texto masivo como Pastor's Line para comunicar mensajes importantes o solicitudes de oración a su congregación. Recuerde usted que donde quiera que esté usted, Dios está consigo. Celebremos con seguridad. Juntos podremos remontar esta tormenta. Gracias.
We are now going to move to our Q&A portion for members of the media. I would like to ask all of our speakers today to please join us again with your audio and video. Please remember, for members of the media, we do have limited time during these briefings. So we are asking you to please limit your questions to the 3 most important, if not less than 3. Also, we want to make sure you understand how to ask your questions. So please raise your hand. The chat, it's right under the participants feature. And we will get started with as many questions as we can get to, but we please ask you to limit just for our time. Okay, we are first going to go to Annie McCormick with 6ABC. You are now unmuted.
Unmute now. Hey, can you hear me?
Yes.
So my first question is for the mayor in regards to the new budget. I realize you said that, I'm wondering if you can give us and the citizens of Philadelphia an idea of how unprecedented this is. And when you were talking about effects that this could have on City Hall, could those effects mean possibly furloughs or layoffs for the city?
Anything's possible. We're working out the numbers now as they come in based on how far this pandemic proceeds, whether hospitals are overrun or whether we have a huge surge or we have more equipment to buy, more trailers, more. We won't really know until another 3 weeks or so. And even then, it won't be enough time to understand fully how this will affect us. It's unprecedented in the fact that it's almost like a depression and a pandemic at the same time. And I don't know if the city's ever gone, or the country has ever gone through that, 2 simultaneous crises.
My second question is in regards to SEPTA. There were 3 workers, maintenance workers that are confirmed dead from COVID-19. That's through SEPTA and through the union. My question is actually for Dr. Farley. In talking with a number of people with SEPTA, their major concern are people riding SEPTA that are not the essential workers, which is why they say it's so important to keep SEPTA operating. And they're wondering if there should be an advisory that people should not even be allowed to ride SEPTA without wearing the cloth mask that the CDC and also Dr. Farley are saying people should be wearing.
I don't know about the enforcement aspect of this. I do think that it's important when people are in SEPTA and they're in close contact with people that they wear a mask. Remember, wearing a mask is about really protecting the people around you. And you're around people when you're in a bus or in a subway, the same way you're around people when you go to the grocery store. So we at least would ask and strongly recommend that people wear a mask when they're in those transit vehicles.
Follow up to that then, I don't know if this is for Brian or for the mayor. I mean, at what point, there's a lot of people with SEPTA that are really concerned at this point. And SEPTA needs to run in order for those essential services, including healthcare workers. Jefferson says that they have about 1,200 employees that rely on SEPTA in order to get to work. Will there be a point where it's going to be limited as far as if people are not wearing masks or are not following the proper guidelines that they won't be allowed to ride SEPTA?
There will be a point if things continue to go the way they're going, but don't know when that's going to be. And there are people who are getting sick and dying in every sector and segment of our economy and workforce. So I don't know the answer to your question, but as we go, as I said when this first started, we adjust every hour, it seems, and we'll continue adjusting till we get to a point where it starts to recede.
Okay, thank you. And I have one more question, if I'm allowed. Just overall crime down overall in the city, are you seeing that? And if so, does that mean that you'll scale back police hours to protect officers? It's a question for Chad Pradelli.
The question was around crime being down. Yes, we are still seeing crime down throughout the city. We at this point don't intend to scale back our deployment given while the majority of crime is down, we still have a number of shootings and violent crime that we're still trying to maintain. So we don't intend to adjust deployment at this time.
Matter of fact, deployment is up because they've taken people out of plain clothes and other divisions and put them in uniform on the street. So actually, we have more uniformed officers on the street than we've had.
Great. Thank you very much.
Thank you, Annie. We're going to go to Joe Holden with CBS 3 now.
Hi, folks. Good afternoon. Question either for the mayor or for Brian. We obtained a letter from Local 22 asking that the union no longer provide numbers of those affected. Just curious if you could expand on why the city would make a request of Local 22.
I don't understand the question. Who sent the letter?
So I'm not sure if it was a letter or if it was an email. Initially, Local 22 provided detailed information to the press. They got out in front of our position, and we wanted to have a conversation with Local 22 about the release of information, which I think they complied with. I don't think there's nothing nefarious around the request by any means.
Okay, second question is the commissioner or any deputy commissioner or a chief inspector, staff inspector, or captain, anybody that you can share with us that may have tested positive for COVID-19?
We're not going to provide details or private health information about any of our employees, no matter the rank.
And lastly, from the city, obviously, we heard the faith aspect heading into tomorrow and then the weekend and next week. Just maybe from the mayor or from Brian, what is the overarching message? This is obviously a very important time for those who practice their faith, yet we are in uncharted waters with gatherings.
I suggest that people pray at home and call their relatives on the phone or do this kind of interaction. Hopefully there will be an Easter and a Passover and a Ramadan next year that people will be alive to celebrate.
Okay, thank you for your time.
Thank you, Joe. We are now going to go to Pat Loeb with KYW. Pat, you are now unmuted.
Thanks, Kelly. I was wondering, is the police commissioner working from home?
Yes, I believe the police commissioner is working from home at this point.
Okay, and do you believe that's the best setup?
We are encouraging all of our employees to work from home right now. She is certainly in regular contact by phone, and I've talked to her multiple times today. So she is continuing to work and command the department that she oversees.
Thank you.
Thanks, Pat. We are now going to go to Mitch Blocker with NBC 10. Mitch.
Thank you. Mr. Mayor O'Brien, is the police commissioner working from home because she is quarantined?
The police commissioner is working from home because that is what she felt was in her best interest and the department's best interest at this point. Again, we're not going to comment on any quarantine or isolation or testing for any of our employees. So I appreciate the question, but I spoke to the commissioner as early as this morning. She is perfectly healthy and fit and raring to go, and again, will command her department appropriately.
Other cities and police departments say that have told us that sharing information contributes to public safety and awareness. Why won't Philadelphia share information about its employees in terms of quarantines?
Again, I'm not sure how it contributes to public safety and awareness. I think, frankly, you all have tried to make that argument. We also have a concern about privacy for our own employees and want to make sure that our employees are protected, and we're committed to making sure that all the information and our deployment measures are out there for all of you to reveal. Now, having said that, we recognize that there are certain numbers that are being released and leaked, and some of them are accurate, and frankly, some of them aren't. So we are reviewing our posture to see if it makes sense to make adjustments. But frankly, I'm going to be a little bit cranky right now, so I apologize. But I'm not sure how it is in your best interest for us to report police officers or any other city staff, so for you all to write about it. I'd certainly love for all of you to write about the positive cases in your departments. So I'm not sure how our public servants are any different than your reporters or your newsroom staff. And so I certainly understand your interest. I respect your interest. I hope you respect our position at this point. And again, we're reviewing our posture, and that posture may change in the future.
All right, I have one more question for Dr. Farley. Dr. Farley, do you believe that all public employees should be wearing a mask right now, at the very least, to set an example?
I think public employees should follow the recommendations we're giving to everyone. And the recommendations we're giving everyone are those from the Centers for Disease Control, which basically say stay home as much as possible. If you have to work, and then when you're around other people, you should be wearing a mask.
Thank you all.
Thanks, Mitch. We're going to go to Sean Walsh with the Inquirer now. You are unmuted.
Thanks very much. Has anyone in the higher levels of the administration or a commissioner of any department or anybody like that tested positive or been presumed positive for coronavirus?
Again, for the third time today, y'all, we are not going to reveal the health information of any of our employees, no matter what their rank.
Even in, I'm talking just the sort of top layer of the administration.
I understand, Sean, and as I answered, this is again the third time I've answered this question today. We are not going to reveal the private health information of any of our employees, no matter their rank, unless and until we think it's appropriate.
Gotcha. Okay, and on the testing sites, sorry, I'm just relaying a question here. Does the city have any plans to address transportation for folks who don't have cars to get to testing sites? Because we're still hearing from folks who are having trouble with that, especially given that Philadelphians say their healthcare providers don't have answers for them, and some are deferring those questions to public health officials.
Again, there are 20 plus sites throughout the greater Philadelphia area where you can get tested, including sites in Center City, sites in North Philadelphia, sites in West Philadelphia, where you can walk up to be tested. So I don't know that having a car makes a difference in terms of access to testing. If there are specifics about these people, you talk about a category of people who you feel can't get tested, they'll let us know. But we've really worked hard to make that testing is available to people. I should be clear though, we're not recommending testing for everybody. We're not recommending testing for people who don't have symptoms. We're not recommending testing for people under the age of 50, even if they have these symptoms, because it's not going to change much about their course. But for those people who need it, we worked hard to make that testing available.
Thanks very much. And I'm sorry to do this, Brian, but to come back to the transparency issue on the cases among city employees, what exactly is the privacy concern if it's X amount of police officers, or 6,000 police officers? Is it about the individual, or what do you mean when you say a privacy concern?
Because all of our departments aren't as large as our police department, and you all have asked not just about our police department, but about all of our departments and all of our divisions. So again, we are exploring our posture, and we'll certainly get back to y'all this week.
Okay, thank you very much.
Thanks, Sean. We're going to go to Martin Pratt with Philly YBN. You are now unmuted.
Thank you for doing this. I have 3 questions. First question is, been seeing a lot, and especially in West Philly and Grays Ferry, of medical grade waste. So masks, gloves, some occasionally glasses, and the yellow personal protective. Are we supplying our trash department with special equipment to dispose of those things that I'm seeing all over the floor, ground, and sidewalks, or is there a plan for that? Or
Martin, that's a good question. I wasn't aware of medical grade material that's been discarded like that, and certainly if it's medical waste, we would want to make sure that an appropriate medical waste hauler was contacted and hauled it away. If it was a paper mask that may have been discarded by a resident, I think that's a different issue, and we think the PPE that we provided, sanitation, should be appropriate. So there's a difference between a paper mask and gloves that a resident may wear versus something that may be coming out of a health facility. And so we would just need to get a little bit more detail and address that appropriately.
The second question is based on the expectation that we will reach a plateau. At that point, will there be any kind of emergency broadcast system implementation, or has it been talked about using the emergency broadcast implementation? And are we looking at, we know that there's a racial disparity in the numbers, and so are we looking at doing any kind of messaging specifically on Instagram, specifically to millennial or Generation Z?
So we have not talked about using the emergency broadcast system. That's similar to my conversation around shelter in place that is generally used for an imminent danger that is coming. We don't think that's necessary at this point as far as specific messaging for millennials or for other groups. I think we are continuing to think through different communication strategies, have reached out to multiple organizations to help us get that word out, and we'll continue to do that because to your point, you're right. I don't have a 22-year-old sitting at home watching this press conference, and so we need to find other ways to get in contact with them, make sure they understand how serious this issue is.
Is there a date that or a limit that a time limit that you're going to be able to come back to us and tell us, hey guys, we've been working on this, messaging, and this is what the results are?
I think I can have the comms office follow up with you directly about what's already been done, and then certainly if you have ideas on what we should be doing in addition, I think we'd love to hear them.
I'm not asking for specifics. I'm asking just in generality. And it's not a police officer question or another city department question, but this is methodology. Since we've instituted the SEPTA backdoor and the trolley and backdoor on the bus policy, does it seem to be working? And if so, what results can you speak on?
It's a hard question for me to answer. We are in regular conversations with SEPTA. I talk to them almost daily about their operations and what their posture is. I don't feel qualified to talk through what the results of that protocol has been, and I know that they are looking to do an announcement later today or tomorrow as well. So I would refer you back to SEPTA, to Scott Sauer, or to Leslie Richardson herself.
Thanks, Martin. We are going to go to Jake Blumgart with WHYY. Jake?
Hi there. I have a couple of questions here for you from various people in our newsroom. One, is there any plan or is the city considering a curfew like Trenton imposed to kind of tamp down on gun violence?
Certainly anything is on the table. At this point, we're not considering a curfew in the immediate sense, but certainly if we feel like it would be helpful to tamp down crime, we certainly would. But it's not being considered right now. Okay.
And Dr. Farley, are you breaking the death cases down by comorbidities at all? Like, heart disease, asthma, things like that?
We have some information on that, but we don't have all the information. And so we haven't posted anything on that. It may not be complete enough for it to be valuable. I'll look and see if it is.
Okay, great, thank you. Then another quick question. Does the city have any strategies in place to address these reports we've been seeing that kind of high income residents appear to be getting tested more than lower income residents?
We don't collect income on testing, and so I am not certain that we have any evidence that says that high-income residents are testing more than low-income residents. We are working hard to make sure that testing is available to everyone who meets the clinical criteria, including making testing available in North Philadelphia, which would be our poorest neighborhood of the city, and West Philadelphia, which would be a close second as far as the poverty in the city. So we want it to be accessible to everybody.
Right. Yeah, I think it's from a Drexel researcher, but okay.
They don't have any information on income any more than we do. All they have is the testing by zip code, and that doesn't really tell you the income of the people being tested.
Okay. Last question for either the mayor or for Brian. So, the mayor was saying at the beginning that there's, obviously the budget has been thrown into turmoil by all this. And I'm wondering if there is just kind of what you guys would hope to see out of, say, future federal stimulus to kind of help cities and states, I guess, but in particular cities and counties kind of dig out from this thing.
Well, we'd like to get reimbursed as much as possible for our expenditures. We'd like to get businesses back up and running as quickly as possible when it's safe, so that they can start taking in revenue, and we can start taking in revenue also. But again, there's no playbook or script for this. We will know what it is when we know, and we will adjust. We don't have the ability to run a deficit. We have to have a balanced budget, and we don't print money. So it's not going to be easy, and it's not going to be pleasant. But at the end of it, we need a balanced budget and a 5-year plan that is balanced. And we'll do whatever we have to do. And it's not going to be nice, and people are going to complain, and they are going to expect certain things to be done that are not going to be done. But when there's no money, there's no money. Right now, we haven't been taking in hardly anything. Use and occupancy tax, people are all closed. Liquor by the drink tax, no one's serving liquor, or restaurants are not open. It's going to be bad for a period of time, but we have to go through it. There's no choice.
Right.
I'd like to actually just stress what the mayor said. The lack of revenue is really going to be part of what drives our budgetary decisions, and the severe impact on our wage and business taxes that we're just going to have to figure out ways to work through it. And unless the federal government provides direct support for city operations beyond reimbursement, we're going to have to make some very difficult decisions.
Okay, thank you very much.
It won't be forever.
Thanks, Jake. All right, we are going to go to Max Marin at Billy Penn. Max.
Hi, thank you so much. This question is for anybody. Could somebody provide some more details about the FEMA decision to close the South Philly site? Was there a funding issue? And do you know if there was similar decisions made in other cities, or was that just here? Just wanted more information about that conversation.
I'm sorry, I didn't hear the question. Was it directed to me?
Sure, yeah, it can be for anybody. Brian, Dr. Farley.
Dr. Farley, it was about the FEMA's decision to close the testing center, and what other, is that a nationwide or statewide policy? And I think you have a little bit more information than I do.
My understanding is that FEMA set up 40 of these sites across the country, and that they're terminating all of them as of this Friday. Certainly other ones in the region and in Montgomery County likewise being terminated this Friday. Now, we could have tried to continue that site with our resources, but we think distributing those resources across multiple sites makes more sense than putting them all on that one site.
Okay, thank you. And Dr. Farley, this is also for you. We noticed this morning there was no more information on the health department's website about the negative test results, which I believe that data was available before. Do you know if that was intentional and if that data is coming back online?
We took it off because we thought people weren't interested in it. If people are interested, we can certainly put in a request, we'll get it to you. The most important part really is how many people are positive.
Okay. And this question is either for the mayor or Mr. Abernathy. When you're in the upcoming budget discussions, will you be consulting? How are you going to be making projections based around the health needs? Are you going to be consulting with health experts and researchers in terms of just what the city's infrastructure is going to need to recover from this? So what is that going to look like in terms of how you approach those reevaluations?
What do you mean by health experts?
Well, I mean, who is going to be part of the conversations around the city?
Every department in the city, our finance folks, our budget folks, those who advise us on our bond rating, on our pension fund, on all the professionals that we use to calculate and put forward a budget every year and a 5-year plan every year. They'll be the same folks we're dealing with. The numbers are going to be what the numbers are going to be, and there's no way around it. And for a year or so, we're going to be struggling.
Will you be, just as a follow-up there, will you be in discussions with other cities that might be further ahead of Philadelphia in terms of their recovery from the pandemic?
I mean, certainly, we can. Other cities are different. Other cities are not as poor. Other cities are bigger. New York has more revenue coming in than probably 3 or 4 cities combined. So we would not discount any advice that they have, but I think we have a unique situation, and we'll make do. 2008, 9, and 10, we went through it, not to this degree, and we came out the other end. And I'm sure back in the Depression, there was similar situations that we've come out of it. So it won't be forever, but it will be painful.
You're hopeful.
Okay. Max, is that it?
Yeah, that's it. Thank you, Mr. Mayor.
Okay, thank you. All right, next, just reminder, we're looking at about 5 more minutes here. So we're gonna try to get through the questions, but if we can't get to everyone, we apologize. Next up, Brian Mendoza at NBC 10 Telemundo. Brian?
Hello, hola, buenos días. Buenas tardes, perdón. Mi pregunta, Armando, es, han habido reportes que se les han realizado pruebas a cientos de oficiales de la policía de Filadelfia y hay unos que supuestamente han resultado positivos. Entonces queremos saber si hay un número exacto disponible y si no se puede dar información acerca de esto, queremos saber el por qué, ya que otras ciudades en el país han sido transparentes con esta información.
Bien. There are reports of hundreds of police officers who have been tested for coronavirus, and many of them have tested apparently positive. What are the exact numbers? If you can't say that, why, when other cities have been transparent in revealing this information?
We're not going to provide additional specific information on the number of officers that have tested positive. I will say it is not hundreds. We believe that this, we don't believe that this information is relevant currently to the public conversation, and are very focused on making sure that our deployment levels are at strengths to keep our citizens and residents safe.
No vamos a proporcionar información adicional respecto al número de oficiales que hayan resultado positivo en su prueba del COVID-19, pero no creemos que esté en los cientos. Nosotros no creemos que esta información sea relevante en estos momentos en la conversación pública y vamos a enfocar nuestros esfuerzos a mantener a los ciudadanos seguros y saludables.
La próxima pregunta es, ¿hay alguna nueva directriz para el Departamento de la Policía de Filadelfia en cuanto al coronavirus? Escuchamos esta mañana que para los jefes o los encargados de los departamentos se les está diciendo que estén pendientes si algún policía muestra algún tipo de señas o de que pueda tener coronavirus.
Quiero confirmar contigo si hay alguna directriz nueva para los oficiales de policía respecto a la COVID-19 y que has escuchado de que algunos jefes de policía les han indicado que hagan qué cosas si sus oficiales muestran positivo.
Sí, esa es la pregunta.
Bien. Is there any new instruction or any new directive towards Philadelphia police officers in regards to COVID-19? And if so, what are the details? He's heard that there's some chiefs of police that have been given instructions about their officers should they turn positive for COVID-19.
There's no additional direction. We have provided direction, so there's no additional direction on how police officers should interact with the public. We have provided guidance to all of our employees, both public safety and non-public safety, as it relates to what they should do should there be a positive test within their unit or in their workplace.
Pruebas adicionales que se proporcionan en este momento con respecto a cómo debieran comportarse los oficiales de policía en su contacto con el público. Nosotros hemos emitido guías y directrices a todos los empleados, aquellos que están involucrados con la salud pública y la seguridad pública y aquellos que no, y cómo hacer en el caso de que ellos resultaran positivos en la prueba.
La última pregunta es, sabemos que los bomberos y el médico, los paramédicos, ellos responden a las llamadas de emergencias, pero a veces tal vez pueden haber casos de que están ayudando a una persona que tenga coronavirus y que no les diga. ¿Hay algún tipo de protocolo para ellos después si se llegan a enterar que la persona que atendieron tiene coronavirus, ¿a estas personas se les está indicando que permanezcan en cuarentena o ha existido ese tipo de problema aquí en Filadelfia?
Un momento. This is about firemen and paramedics, and when they respond to emergency calls, if there are several of them that have been tested or are in quarantine, what is the instructions for them if they help someone who later turns out to be positive for COVID-19? Are there any instructions given to them? Are they going to be kept in quarantine?
If our firefighters or EMS workers don their personal protective equipment as they should, there is no additional instruction, from my understanding, for quarantine after that. Again, they need to don their personal protective equipment, and we can certainly, if there's anything incorrect, we'll certainly circle back with you, but that's my understanding.
Según entiendo, las instrucciones continúan con que los trabajadores tengan puesto su equipo de protección personal como debieran tenerlo y no se ha emitido ninguna instrucción adicional al respecto, ni tampoco tengo información de cuarentena que se haya planificado para ello. Si esto cambia o estoy equivocado, pues lo rectificaremos.
Yes.
I want to clarify something I said earlier, and back to your point, Brian, about additional steps the police have taken. The police have been distributed cloth masks to wear in public, but again, that goes in line with the direction from the CDC and other public guidance provided to people, but I wanted to make sure that clarification was made. I apologize.
Quería hacer una aclaración, Brian, con respecto a tu pregunta. Quería establecer de que los pasos adicionales que se le ha encomendado a la policía consiste en la distribución de mascarillas de tela para su uso en observancia de las directrices que ha dirigido la CDC y las otras organizaciones para proteger a la gente. Solamente quería rectificar eso.
Gracias.
You're welcome.
Okay. Thank you, Brian. All right, we have limited time, so if I could ask the next couple outlets to just limit it to your one and only question, and we'll try to get to some other questions via email. All right, Marcus Espinoza with Fox 29.
Hi guys, how you doing today? I just want to ask again to the mayor or to Brian regarding SEPTA. What is the actual tipping point? Is there a number of deaths? Is there a number of things that happen that would cause the traveling route to be reconsidered for folks? And what is the alternative for people who strictly use SEPTA if they are still an essential worker to get to work? So just some specifics on that. What would it take, basically?
And Mayor, I don't know if you want to answer or if you want to defer to me.
We should check with SEPTA and get back to you and try to figure out what their idea is. Obviously we don't run SEPTA. We certainly have a hand in it, but it's not, an agency of the city. So we could check with them and get back, unless Brian, you have any more information that I have.
Yeah, I mean, look, SEPTA is an essential transportation network that we're going to need for essential workers to get to and from work. That includes folks that work in our healthcare systems. That includes food service people. It includes our grocery store workers. And so we've expressed to SEPTA that we want to make sure that they continue to operate, but also understand their concerns, their operational concerns, and I think they will be making adjustments. But at this point, looking at what other cities have done, I don't believe any transit agencies have shut down in other major cities, and certainly would have great concerns should that happen here.
Okay, thank you.
Thanks, Marcus. We're going to go to Mike D'Onofrio with the Tribune. Mike?
Yes, thank you. I was wondering, does the administration have any figures about at-home deaths and how many there have been in the city in March and April? Because I'm trying to follow up and see if you have any updates too on the number of deaths currently being investigated that may be linked to the coronavirus.
I'll take that. So, we have, there's always a number of deaths that are possible coronavirus deaths that we're investigating, so we can't give you a specific number. Many of those will prove no longer to be coronavirus deaths when we have all the information. And we are aware of some of the deaths that occurred at home, but I don't know if we're actually tracking that. So don't know if I can give you a number on that.
All right.
Okay. Thank you, Mike.
Yep.
All right, Andy Metzger, you can go ahead. Andy?
There we go. Okay.
Yep.
Sorry about that. My sense is that the one reason why people are so interested in the number of police and firefighters, et cetera, who may be infected with COVID is that for better or worse, the people might regulate their behavior, and do they think it's worth calling the police based on that information, similar to how people regulate their behavior just based on the overall population numbers. And I think you've said that there's a threshold above which you would consider reporting out the number of, say, police and firefighters who have tested positive. You've said that it's not hundreds right now, but could you put a number to the threshold, if there is one, about, above that you would report out the number of people infected?
Sure, Andy, and it allows me to clarify a couple of things as well, so I appreciate the question. So I think, one, if we believed our deployment levels were impacted by the number of individuals who are either out or quarantined or reporting sick, we would certainly let the public know that there were deployment issues. We're nowhere near that point, and in fact, our deployment is, as the mayor indicated, is higher than it has been historically because we have put more officers on the street. I also referenced that we may be changing that posture based on numbers that are coming out in various forms. We want to make sure that the information that is circulating through the press is accurate, and in some cases it is, and in some cases it's not. And so we may be changing our posture in the very sense of just to make sure that if information is going to be reported, that it is reported accurately, so we're actively in that conversation. And I do also want to clarify something I said earlier about Commissioner Outlaw working at home. While she is primarily based at home, she is still doing field work. She is still talking to her staff. She is still out and about. So just because she's not at PAB doesn't mean that she is quarantined at home. She's not. And so I just wanted to make sure that that was clear as well.
Thank you.
Thank you, Andy. Now we are going to go to Jack Thomson with Metro. Jack?
Yes, regarding the the faith communities and the holidays coming up, have there been any instances of churches or other faith communities holding in-person gatherings or gatherings that violate the guidelines? I know the Archdiocese of Philadelphia has had live streams of masses that appear to be attended by multiple people.
We've heard reports of a number of faith institutions that have not followed guidelines, and I think our comment would be that faith institutions or the buildings that religious leaders use should follow the same guidelines that any business should use, and if necessary, the city could take action on those buildings as well. Certainly not where we want to be, and we hope that all of our faith leaders follow the Reverend's advice, follow Dr. Farley's advice to keep their parishioners and their family members safe in this time of crisis.
Okay, thank you.
Thanks, Jack. Our final question is from Denise Clay with the Philadelphia Sunday Sun. Denise?
Hello. My question is, since we're not giving the numbers of police and fire that are actually police and fire or city employees that actually have tested positive for the virus to the public, are we at least letting the people in those departments know so they can, better protect themselves?
For any unit, just like we would do for the public, any person that tests positive, we do certainly inform their place of work, their supervisors, their coworkers should they need to quarantine, and every work site is cleaned thoroughly and sanitized. So all of that work is continuing and being provided.
Okay. Now, you said that the city is reevaluating their posture on letting the community know how many people have tested positive. Is there any timeline for when you might come to a decision on whether you're going to stay your current course or you're going to change things?
No. I think we're in active conversation. We certainly understand your interest. I'm not certain I understand the public's interest is as anxious as yours, but I appreciate again all of the media's interest, and I appreciate y'all's patience as we review our position.
Okay, thank you, Denise. And that concludes our daily briefing for today. Thank you all.
Thank you.